to chat with us this evening. We thought that as the Implant Surgery, that something that would be really interesting would be to be able to talk about what is current in dentistry. We've slightly cheekily turned a series of some video clips like this evening about called Filling in the Gaps, because actually dentistry is an interesting industry, I think, but sometimes we keep our different sections and departments to ourselves. You and I have known each other, I would think, for 20 years.
At least,
yeah. Maybe. Yeah. And we've always had a very harmonious relationship between what is, I think, the clinical side of dentistry and the industry side of dentistry. I think somewhere in that, perhaps, sometimes that communications get caught on just doing sales rather than ever getting to the point where you talk about where does a product lead us, where does the future lead us. I think that this is the most exciting time in dentistry since really I can't think when. I think we have the advent of biomaterials that are phenomenally interesting, and me as an implant dentistry, to me that's a huge stimulus. But for the other part of dentistry is digital. Digital is a word that seems to go everywhere.
Sure.
And we get incredibly excited from the point of view that we can use it to educate our patients. I use it particularly for planning. For all of my implant cases, we combine digital impressions with CT scans, and then I think it would probably be fair to say that question of digital dentistry has crept into the laboratory side for good and worse. And so many people are having crowns made now talking about the digital workflow. You working for Henry Schein, what a broad spectrum of companies that Henry Schein is or owns.
Absolutely. My role is a new role, and I work closely with the sales and marketing team in UK, Ireland and South Africa, working in an area that we would call brand equity. And brand equity are any products, companies that we own as a Henry Schein Group.
Actually, what sort of companies do you own?
So there are a number of companies, and that one being how I became involved in the Henry Schein world, and I worked when we first met, as you know, with Nocton for 27 years, and this move was a progression for me into a different part of the business, and obviously Optident grew to the business that it is today. And almost 7 years ago, there was the acquisition through Henry Schein, with still involvement with the Butterfield family, with Tim, and being involved in the business, as you know.
And so Optident, then and now, still really are a focus on high-end products with aesthetics in mind, or where do they sit in the branding of? Because if you're dealing with different brands, presumably there's different areas of focus or interest in.
The Optident initially, as you know, was a niche, if you want, for want of a better phrase, a niche supply company. But we had a very broad range and some phenomenal products in and amongst the range as we grew, and some real firsts. Talking about acid etchings and working with dentin and then wet bonding, and you know, it was a revolutionary time, and you said earlier about the market changing and how exciting things are now. I see this digital era as we're here to talk about, as an exciting time. It's the next exciting time, and we're living it. It's not something that's the future. We're actually in and amongst it. You know, similarly with the composite, where we were stratifying and we were working with products that were optically similar to the natural tissues. It was really quite different. And Optident now have developed their own composite, working closely with Stan Italiano. Again, very much in that aesthetics arena.
Is that driven, do you think, because I talk about digital dentistry as something that is sometimes about machines or products. are we getting perhaps two parts of digital dentistry sitting side by side? Digital must be that it means that if I talk about a material or a product or a procedure, that digital also comes from a patient perspective. And somewhere in that, does that drive the industry?
Yeah, and I guess the point you're making is one that I feel very, very strongly about, that digital dentistry has been around a long time, but it's fundamental to dentistry, and people can enter digital dentistry at different levels, and by no means, Simon, am I any expert on the hardware and the digital side of things. Henry Schein has an amazing team that support that, but behind that also is a team of very skilled people who can take the end-to-end process, and I think that's really what you're referring to, that it's more than just hardware. There's a whole process to this, from the education of the patient to the finished restorations, and everything in between, including implantology.
What does your team do for that? They will guide. Are you guiding the industry? Are you guiding clinicians? Are you guiding laboratories? What does the Henry Schein?
I think it's touching all those areas, and you know, globally as a company, we touch so many areas. And as I say, the strength being, we have in each of those areas specialist teams and people who can support in those areas. So there's a lab group, there's a hardware team, there's training support, and the many facets that you're going to need to help you along the journey. And of course, people are at different stages of that journey, and that team is specialised and will take people through. But also developing and bringing new products to the market, and innovating, and that's, with the global reach that Henry Schein has, that's something that we can do.
We knew each other in the days where we were both involved in education, and I think dentist education, patient education, actually, I think now this is an area where we really need as dentists to be on the top of our game. Perhaps it's partly even the reason why you and I end up chatting on video together.
Sure.
Because isn't it a great medium to get across to people?
Yes. Absolutely. So the nature of the business is, you know, we can offer the options and support the options with the teams that we have in those various areas.
Well, David, the more I talk to you, the more I think to myself, gosh, isn't it an interesting company with all those different facets? I'm fascinated by the fact that you own more than one implant company. To me, I think, wow, isn't that interesting? But with the size of your business, that they are able to also input into the advice where one brand is helpful versus another brand.
And as with the implant market, they have different uses, and you know far better than I. And again, we have specialist implant teams. They have different uses, they have different applications, different techniques around them. So, for example, we have BioHorizons business in the UK, which is within the group but operates in an independent way as well. And I know you have contact with them and work with them on various areas. And then there are other brands in and amongst the wider business.
You keep that something as a core group, and some sit on the. I guess that's the same as that. Back to the question of where do some niche products sit? You know,
it's like being an implantologist in a general practice, I guess, isn't it?
It's exactly that.
Yeah.
David, thank you so much for chatting to me this evening. It's just to get an insight as to how we work together with industry. I'm delighted to have known you for 20 years. I wonder whether I could do another 20. David, thank you.